It's been more than 40 years since AIDS was first identified in the U.S., and researchers began looking for a cure. This is Dr. Anthony Fauci in 1984.
And hopefully, our recent advances of being able to isolate, identify, and characterize the agent will allow us over the next year to come back to you and tell you that we now not only have hope and hypothesis, but that we have a real prevention and indeed a real cure.
And here's Fauci earlier this year admitting a cure remains elusive.
We understandably, but somewhat naively perhaps, felt that if we just took the same approach to developing an HIV vaccine as we did to any other vaccine, vaccinate with somebody, they would make an adequate immune response, and that would be it.
In the U.S., about 1.2 million people are living with HIV/AIDS. There are about 30,000 new infections every year. 71% of new cases are in men who report having sex with other men. 22% are people who say they are heterosexual, and 7% are in IV drug users. While no cures or vaccines have been developed, effective strategies to deal with the epidemic have been developed. They include expanded testing, including home test kits, medicines for those who have contracted HIV, and treatment to help prevent people from contracting HIV.
PrEP, or pre-exposure prophylaxis, is a medicine that can prevent HIV.
But progress has been uneven. Whites make up about 3/4 of the U.S. population, but account for only 1/4 of new cases. Blacks make up about 14% of the U.S. population, but account for 42% of new HIV diagnoses, while being less likely to receive testing or treatment and having a higher chance of dying from AIDS compared to whites. The theme of this year's AIDS Day is putting ourselves to the test, achieving equity to end HIV.
As a nation, we're putting ourselves to the test to see if we'll use the tools that we all know we have and create equitable access to those tools to end the HIV epidemic in the United States.
Researchers here at the U.S. National Institutes of Health hope lessons learned from the COVID-19 pandemic will help them develop more effective treatments for HIV/AIDS. Jim Spellman, CGTN, Bethesda, Maryland.